Welcome to our latest webinar, Life Care Management, presented by Bobbi Kolonay of Holistic Aging. Bobbi is the president of Holistic Aging, which was founded in 2002. Bobbi graduated from Duquesne University with her Bachelor of Science in Nursing. And she also has a Master of Science in Human Resource Management from La Roche University. Bobbi has served on the board of directors of Aging Life Care Association and is a fellow of their Leadership Academy. Bobbi has over 35 years of experience in the care management industry, and she is viewed by her peers and other professionals as a seasoned expert in the management of care with the aging and disabled population. Bobbi has presented at numerous national conferences, including the Alzheimer's Association Conference. She has also contributed to over 50 articles and publications. Bobbi will be talking about life care management, which is a private pay service, and all of the benefits and services that can be provided. So now I'd like to introduce Bobbi and hand it over to her. And thank you so much for your time, Bobbi.
You're welcome. Thanks for that great introduction, Casey. So what I'm going to do now is I'm going to share my screen and then we'll go right into the presentation here. I'll admit that person too. All right, so people will have to let me know they can see my screen. Casey. All right, so
actually, we can't see your screen yet.
You can't see the screen. Uh-oh.
I was just going to say, I can hear you well.
Okay, let me try that again. Share screen, desktop, share. Okay, there we go. There we go. Can everyone see that now? Okay. All right, so Casey already gave me this fabulous introduction. I don't have to go through that. This is me before I went gray. So our office is located in Allison Park. And we've been there for maybe the past 6 or 7 years. It's right on Route 8. So I am, what I do, we're called Aging Life Care Managers. We call ourselves care managers to not inflict with our title. So there's an organization, the Aging Life Care Management Organization, and over the nation in every state, there are people that do similar things to what I do. Everyone has a different educational background. We in Pittsburgh, my company, we're more nursing focused. I have 3 aging life care managers that are nurses and 1 that's licensed as a speech therapist. But throughout the nation, there are organizations similar to mine and probably in most of the states and also in Canada. And that you'll see licensures of social work, psychologists, physical therapists. It really varies. It's a small cottage type industry, and we have grown a lot. And I have been on there, was in the past on their board of directors, as Casey had mentioned. If you search, you could go right to the Aging Life Care Management website and search. There's a search engine, and you can search for a care manager in a specific geographical area. When you're using an Aging Life Care Manager, most of them have master's degrees of some type in an aging field. Most of them are very experienced. Most of our members are in their 40s and they've worked, in varying settings throughout the healthcare system. And this is the end, they're starting a business. They're licensed, as a practitioner of some kind, and also the majority are certified, and there's care management or case management certifications. So it's that when you're going to aging life care management for services, you're going to find very highly qualified people that have been doing this for years and really understand the system and how to manipulate the system very well. So you go to aginglifecare.org, and if you search, you'll see right at the top, I think it's the right-hand side, there's a search engine where you enter like the city and the zip code. So when you're looking, I've been in business almost 20 years, as Casey said, and the age wave is here. It's coming. I'm at the back end of that myself. I'm 60, so in the next, every day for the next 2 decades, over 10,000 people turned 65 years old. So Allegheny County, we are second to Dade County, Florida, with the highest population of people over the age of 65, and that's projected. We're projected to surpass Dade County, Florida, and be the #1 in the nation. So Pittsburgh area, and so there's more people aging, more people going to get age-related diseases. We're living longer, we're more engaged in life, and we're healthier. So whether you have, Parkinson's, or you have any kind of neurological or cognitive disorder, you want to age well. And that's what our company is called Holistic Aging, and it helps you that. You really don't want to focus on the disease, but you want to focus on what you can do to help you improve the quality of your life, even though you may have some hurdles to overcome. So more than likely, someone will need our service. We are a private pay aging life care management service. When you're looking at the cost of our service, it's different depending, across the nation, because prices fluctuate, but you're probably going to pay anywhere from, $120 in more remote areas to, New York City, they're $250 an hour. So $125 to $250 an hour is, the average cost to hire an aging life care manager. Not covered by insurance. Most long-term care policies, if you have those, will cover care management services. So when you look at it, nearly 70% of individuals over the 85 could become cognitively impaired or need assistance with at least 2 activities of daily living, eating, bathing, and over 50% of people over the age of 85 will have some form of dementia. And as you know, with Parkinson's disease, some people, as they progress through the disease, do have cognitive impairments that need to be addressed. And again, you're not going to focus on what they can't do, but you always want to focus on what people can do. A lot of this is referring to parents, because most of our referrals come from adult children that are the powers of attorney of the disabled or older client. So that's why you'll see the reference to parents a lot. Just flipping through my notes here. So you really want to, just like you pre-plan your powers of attorney for, hopefully for crisis, your medical power of attorney, your financial power of attorney, you want to pre-plan the potential of something happening to you in the future. And we always say, create some kind of safety net. Because if you're doing it as a crisis, which 80% of the people call us when it's a crisis, and the first thing they always say is, "Oh, I wish I would have known about you, a year ago." So what you want to look at, so you don't want to make a stressful, hasty decision and choose the wrong person for help. When meals become difficult to manage, when driving becomes difficult, if memory is failing, if physically you're having disability type issues that you're needing additional help, it's really good to get a hold of an aging life care manager who knows the system and really can save money and a lot of stress over the long run. I always say, Dr. Google does not have those answers. So whenever we are managing a client's case, we look at all these different areas. Some families or clients, they hire us to do all of this. Some hire us to just do a little. So we know what is the best living environment. We always say, home is the best until it becomes a danger to yourself or a danger to others. And with COVID, I think people are recognizing that factor more than ever. We've been saying this since we've started the business because we knew that. But there are times when care can't be managed in the home anymore. If you end up needing caregiving services, the cost for that, if you look at it, I always use the analogy, once you get to 8 hours of care in the home, it's sometimes less expensive to live in an assisted living. So if that financial limitation prevents you from aging well, you want to look at, an assisted living. Most of the public doesn't understand the difference between independent living, assisted living, personal care homes, and there's continuing care retirement communities, and there's a type A and a type C and a type B. And people really don't understand the difference. They'll tell me, "Oh, I want to go to, my friends are all in Longwood, and Longwood is a type A continuing care retirement community that you have to enter healthy." As that's just an example. And there's a few of those in the maybe about 5 or 6 of those in the Pittsburgh area. And there's type C's continuing care retirement communities. We know them all. We've been in every single facility over the past 20 years, a lot of the new ones even. And so some families may just hire us to say, "Hey, I can't do this in the home anymore," or "Can you help me in the home?" And then we just did a case that we just finished today. "Help me in the home," and he has Parkinson's. And then, offer me recommendations on where I can economically afford, or what's the best place in the future when I can't manage it at home. And we write up a plan and do that for them. As nurses, we manage the disease. So when we come in and you hire us to manage the service over, your care over a period of time, I would say, a given time, 25% of our clients have Parkinson's disease, among, many other things also. So we help manage the disease. We know the disease. We know when your carbidopa is timing off. We know the highest doses. We know the things you can add to increase. We work well with your neurologist, the specialists that are the neurology specialists that are in Presby and the Parkinson's group. They know us by name. The PA knows us because we're bringing our clients to the physician's office if they want us to, and we're advocating for them. We're driving them in our car and advocating for them there. So we really know the disease. We know how to treat the low blood pressure and how to treat the dizzy symptoms. We're managing it through the end of the person's life, and making sure that all the things are in place that they can age well then. So part of that, one of the most important things, which you're probably all aware with Parkinson's, is that you continue to, movement is really important. So you want to always maximize the, your benefits for physical therapy, occupational therapy, Part A of, if you're over 65, Part A of Medicare, Part B of Medicare. And we know how to manipulate the insurance. So we'll maximize any of your local resources. There is great, you probably, there's for Parkinson's, there's 2 or 3 box places that you can do the boxing in that is great because it's the neurological component of when you're boxing really seems to help with Parkinson's disease. So there's right on Route 8, there's a boxing place in Ellison Park where a lot of our clients have gone. There's Encompass, used to be the old Harmerville Rehabilitation Center. They have a whole network, which most of you are familiar with that, and great local resources. We work with, once your insurance runs out, if you can pay, we work with private paid physical therapists that go to the home. And even there's a new physical therapy group that's starting a private practice on Saxonburg Boulevard in the Pittsburgh area, where they're going to have a gym and they're going to offer things for, specific for Parkinson's group. They should be opening up in the next month or so. And I'll be glad to give anyone their information at the end of this. So we also make sure all the legal and financial things are in place. You need to have a power of attorney, the medical power of attorney, financial power of attorney, living will, and you need to understand your living will. If an attorney explained that to you and not a medical person, we review living wills and the consequences of the decisions you're making in your living will. A lot of our clients have some type of memory disorder. We're really specialists with knowing the type and how to treat it. And also, how to allow that person to age well with the memory disorder. We work with lots of families, some families with 2 kids, some with 10, and the dynamics of that, and being able to help families use our expertise to come to a decision where they probably couldn't have on their own without us helping them through the process. In Pittsburgh, we see lots of polypharmacology. What that means is medications that people are on that no one have looked at in the past 20 years, and do they still need to be on them? So when we're doing an assessment, we're going to look at all the person's medication and offer recommendations to the family and the client on things that, by the American Society of Geriatrics, someone shouldn't be on for an extended period of time. Well, and they can do whatever they want with that information. Some of them choose to let us talk to the doctor to get the person off of that. And we have really good luck with that. Maximize whatever the local resources are. So if you qualify for any type of entitlements, VA benefits, there's lots of great, if you're a veteran and served in a time of war, there's lots of untapped resources for there. If you're lower income through the Area on Aging, there's lots of local resources, and even local resources. We know how to maximize, we know all the insurances in Pittsburgh and how to maximize your health insurance benefits to individualize to you. We also, our name is Holistic Aging. So I have studied medicine throughout the world. I have traveled to lots of foreign countries and learned their indigenous medicine. So if someone's interested in that, we can bring that into play also. It's totally up to the individual. So I just did all this without clicking. So again, we do take people to physicians' appointments and help the client themselves advocate for themselves. And then when we can't, we we can jump in and talk to the doctor. Maximize the local resources, work with families, very well work with families, offer the holistic care. So where do I turn? If you look at, there's lots of, and you may have already tried a lot of these. So there's a lot of programs out there that you don't have to pay for. People think, oh, Medicare, it pays for everything, but Medicare, as if you have experienced it, Medicare does not pay for any in-home caregiving type service. Medicaid could, if you're lower income. Medicaid is geared towards more care in the home now than it has in the past. But with COVID, the lack of resources for caregivers is just astronomical throughout the whole system. There's, you could look at subsidized housings. And as I said, through the VA, there's lots of wonderful VA programs. And we can help you maximize the use of any of those programs you would qualify for. So veterans, there's the aid and attendance program. You may be familiar with. If I think you have to have you could have money in a trust, or you could have income under the level, I think it's around 120, or assets under 120,000 that are visible. And then you can qualify for up to $25,000 a year to help with your medical care. It's usually caregiving care. The Area on Aging has lots of programs for lower income. They do get budget cuts the end of the year, and a lot of what their benefits are depends on the party that's, in service, that's currently in service. There's senior information and assistance programs, senior center. A lot of churches have parish nurses. There's faith communities. Whoops, you'll see. I'll just get that. You'll hear advertised Place for Mom, places like that offer what they call free placement services. Just realize they're not free. Who is paying their fee is the assisted living that they're recommending. So most of the places, as a member of the Aging Life Care Association, we're not allowed to take any referral fees. It's part of our code of ethics. And most of the places that we refer to don't pay placement service fees anyhow. So realize if you're using one of those free services, it's very limited where they can recommend. And they can recommend somewhere where they're going to make the most profit with that recommendation. And they're usually not, a lot of them have a business background. They're usually not healthcare providers. And then you have fee for services. And, I'm a member of the Aging Life Care Organization. There are other types of organizations that I would just say be very cautious with the other organizations on the level of the qualifications of their members. Just because you took care of your mom doesn't mean that you have the knowledge base for other care. So when you're using a member of the Aging Life Care Associations, we know all the alternatives for care. We know how to vet all the places that we're recommending. We can negotiate prices sometimes with assisted living, sometimes with varying type of programs. We work really well. So if you're hospitalized, we start the process. We usually try to attend so now with COVID, most facilities are allowing one primary person in. So if the family chooses to let that be us, we go in the emergency room with them and start that process from the very beginning of making sure that the care you're receiving in the hospital is of the highest quality, that you're maximizing your insurance benefits, that if any of you have ever been admitted under an observation status, there's a whole lot that has to go with that. A lot of us have worked for managed care organizations in the past or I myself, I was a care manager in Presby for years before I started this business, and had worked on the insurance side and inpatient side for UPMC and other insurance companies. So we work really well with the care managers in the hospital, the doctors, and we're making sure that you're getting the best care possible. Let's do this. So we know all the possibilities. It's what we're experts at. So I've already mentioned this fairly briefly. So aging life care managers, they're a licensed professional. Usually the most typical, you'll see registered nurses, social workers, physical occupational therapists, gerontologists, and other healthcare professionals. They really are experts and with knowledge and insight. And, we have a vast network nationally all over the United States of at least 2,000. Very strict code of ethics and standard of practice that we're all required to follow. This slide, our fees are higher now than they were when I made this up. So as I said, it's around 125 to get into New York City, you'll get $250 an hour or so. So when we provide lots of professional support, so we can help access whatever the needs are. So when we're doing an assessment, we're going to offer recommendations to the family. So what we usually do, we get the client and the family's input on paper. We analyze that, we go in and we do an initial assessment. So that's going to be a physical assessment, a cognitive assessment. We're looking at the environment. We're making sure things are in place that need to be in place. We develop a plan with recommendations. Family comes back to us and they say, okay, here's what I want you to do. So the family and the client are deeply involved in the service we provide. They're paying for the service. They're our bosses. They we're their experts. We're recommending things and we're only doing what they want us to do. We can link you to any services that are available. And again, we're going to maximize whatever entitlements you have to pay for those services. We do have lots of, our saying is there is no functional family, including our own family. So we do help families mediate any kind of conflicts, and it's a very positive experience. Most of our clients that hire us, we stay on for their life if affordability of our service isn't a concern. We also help manage crisis. So, we don't guarantee 24/7 coverage, but because we sleep at night, I always say my staff has to sleep, but they typically can respond to, emergency situations between the hours of, they're usually, I say 9 to 5, and they always do it a lot later than that. And, if someone goes to the emergency room, at 7 at night, sometimes they're waiting until they're admitted and everything is taken care of before they're leaving. But again, it's what the family wants us to do. If families don't want us to do that, we don't. Worry, over the long term, we're monitoring the person within. If you read our reviews, people feel like we've changed and altered the health of their life. So we're monitoring them. We're preventing emergencies. We'll have clients that are in and out of the ER every month or more with, falling, dizziness. When we get involved, that unless they fall and break a hip, we're able to prevent most of those. Again, because we're clinicians, we're nurses, and we try to prevent the emergency before it happens. We communicate with families, if they're out of state, by email or phone, whatever they'd like us to do. Any change in anything, we're always in communication with the family. Gives family members peace of mind, and we constantly are reevaluating and adjusting our plan of care. We actually do it in a formal written format about every 6 weeks or so. We are probably the only, care is so compartmentalized now. And then with COVID, I feel like it's even gotten worse than it was pre-COVID. So we are the coordination of care for the person. We're the ones, if needed, we're the ones coordinating between the PCP, the neurologist, and any other doctors that you see, the cardiac surgeon or cardiologist. We are the ones managing that care for the client. We prevent hospitalizations and, make sure all the medications that are prescribed are necessarily needed. Sometimes when you go into, some doctors' offices, they almost feel like they need to give you something to leave with. So we're making sure that it's that, what you're only on the medication that you need to be on. There's so many side effects to medications. We advocate for you at all times. We make sure the quality of your care, that it's high quality and effective, and we help manage the disease. And we like to say we come from a state of wellness. So if you're looking at, not everyone is interested in holistic care or alternative methods, and that's fine. We don't push anything on people. But if you're looking for general alternatives, some of the options that we have used, I'm a certified clinical aromatherapist. That was a very in-depth 2-year program. And so we will use, if the client is interested, they're having anxiety, there are certain aromatherapies you can diffuse through the environment that help with that. These are just some very simple examples. Meditation. I don't know if you've studied at all anything about what meditation does to your brain. It really helps your brain it slows down the aging process, increases the length of the telomeres that they've shown. Someone with higher length of those live longer. So we can teach meditation to someone. A few of our clients want massages, so we recommend, we used to have a massage therapist, but since COVID, we don't have that anymore. But we can bring you to massage. We have we work with, some private pay physical therapists or massage therapists that will go to your home. There's lots of herbs that, as simple as drinking like a herbal tea that can help if you have anxiety or irritability. And there's simple teas you can drink, herbal supplements. One of the main things we notice is a lot of our clients, because preparing meals is a very sequential and ends up being a difficult task. So when we're doing an assessment, they're eating a lot of processed foods. If you look at Hippocrates, the father of modern medicine, says, "Let food be thy medicine." So, and medicine be thy food. So with all of our clients, we really try to look at their diet, improve their diet in any way that we can. And it's one of the most effective ways if someone is in poor health that we have found to really improve the quality of the person's life. And there's certain foods that help you age better. If you've probably heard that an alkaline diet can help detoxify your body if you have a lot of inflammation. Mediterranean, if you have cognitive issues, has been proven to be the most successful diet for someone to eat that has any kind of cognitive issues. And the massage therapist that we use does do Reiki. It's a type of healing touch energy medicine. So the benefits of using care managers are they're experts at the pros and cons of most aging issues. We thoroughly vet any facility or service that we're recommending. And again, we're not getting money from anyone. This is just our experience in the know of the services that are available in the area. We're dual professionals in both modern medicine and alternative care. We're able to offer recommendations on a wide range of options, and we work for you. So unlike, you'll hear their care managers, insurance companies have care managers, hospitals have them. You have to recognize those people are working for the hospital, for the insurance carrier, and their goal is very different than what our goal would be for working for you. So what we really like you to help avoid is having a crisis where you have to make some crisis decisions and it ends up not being in the best decision. So, hopefully by listening to this, it's given you some ideas on planning for your future in the management of Parkinson's disease, which, sometimes that can be a 20-year management. Sometimes it can be, depending on the time of onset, a much shorter time crunch. So let's hope that this isn't you, but that this is you. So there's a crisis. You're calling a care manager for help, and you can make an informed decision. I appreciate everyone attending this. And if I could even answer, any direct questions you might have about Parkinson's or any way that we've helped people with Parkinson's disease to manage their services. So Casey, do you want to? So if anyone knows how to use the chat button, if you know how to use that, if you could put your questions in the chat. Mm-hmm. If you don't, Casey, maybe they could raise their hand or something.
Sure.
Just like that, raise their hand.
I think what we've done in the past, someone raises their hand and then you can just unmute yourself and ask the question.
Yes.
Okay. If anyone has any questions, Bobbi is ready. And thank you for that wonderful and comprehensive presentation.
Sure.
Anyone have any? Questions?
If anyone doesn't know how to unmute, they want to raise their hand.
Oh, that's right. Yes. That is true. Oh, there's someone. What is the difference between what you do and a geriatric care manager?
Oh, great question. So it's the exact same thing. So when I was on the board of directors about 4 years ago, 8 years ago, we rebranded. And we went from the geriatric care manager to the aging life care manager. So it's just a rebrand to update that we're not just about geriatrics, but we're about anyone that's aging.
That's very good to know.
Yeah, and it used to be referred to as the national, it's a very long, it was a great rebranding. The National Society of Geriatric Care Managers. It was very long. Yeah. So I think it's been probably about 8 years that we rebranded, but it's the Same exact organization.
And how many aging care managers do you have
I have
in your
4.
company? 4.
Yeah, I have 4, not counting myself. And 3 of them are licensed as nurses, and 1 is a speech pathologist, and they specialize in working with people with neurocognitive disorders, speech therapists. So.
And do you have a certain territory that you'll cover?
We go within a 60-mile radius of our office. We've even known to go further, like that but it's all, we charge for our travel time. So we'll charge from the time we leave the office to the time we return. But it isn't all, if my staff's, most of my employees work from home mostly. They don't want to work in the office. So if they're going to visit people that are all in the same geographical location. So that's usually the most that'll be charged. But I just did a case in Morgantown, West Virginia, which is a little farther than that, but the whole West Virginia area does not have any aging life care managers. So we can't really manage the case there very well, but we've gone in and done assessments just to help families out.
I have a question. I just a few months ago went to an elder attorney and got all the paperwork filled out, including a new will because mine was 40 years old, and life had changed a great deal. And got the medical power of attorney, the financial power of attorney, and the living will. Now, she is on the board of directors of PFWPA, and is familiar with Parkinson's and its progression, and told me that when the time would be coming near that I might need to be looking into a long-term care facility, whether it be assisted living or personal care or whatever, that I should talk to her, that she would know all the ways to move my money and protect it so that I didn't have to spend it all down in order to qualify for Medicaid and so on. Now, do you also do that?
Well, we don't. So if you're working, and do you mind saying who the attorney is? It's up to you. You don't have to.
I'm embarrassed. I'm blank on her name. Casey, you can help me. She's with Julian Gray.
Oh, okay. Jennifer Rose.
Thank you.
Rose. That's what I thought it was. So we work with Jennifer a lot. I just love everything about Jennifer, her personality too. We refer Jennifer's who we refer back and forth to more than any other elder attorney in Pittsburgh. So Jennifer, she's working with your finances, and
right.
If she told you that you don't need to do anything now and you could wait till later, she knows, you have to be, just like with aging life care managers, just because an attorney works with aging doesn't mean they understand that. Jennifer is an expert in understanding skilled services and financial planning and how to preserve your assets as much as you need to. And it's a very, I'd have to ask you a lot of questions to understand her recommendations. I don't want to do that here. They're of personal nature. So I would say whatever, I know Jennifer very well, and whatever advice she gave you, follow that. Okay. But she's not going to recommend care services. She's going to recommend how to manage.
So as far as whether it would be the A, B, or C kind of facility and that kind of thing, that's what you would more?
Well, skilled facilities, so that's one of the levels of care. There's assisted living, there's personal care. Skilled is when you need, and she's probably talking about intermediate care in a skilled facility when, so what we do is we are typically going to get involved before skilled to stop the need for skilled until it's not, until you have to. We try to keep our clients out of a skilled facility if we can, and manage the care in the home rather than in a, but again, you have to look at the whole picture.
Yeah, I hope I'm looking long-term. I was only diagnosed 3 years ago, and it's with Parkinsonism rather than PD itself.
Right.
And so Dr. Baser said that it may progress much more slowly
Yes.
because of what caused it is not the brain implications that causes PD.
Right.
And that it may actually even just stay the same for a long time.
Yeah.
So hopefully, I have many years. I'm doing well now on my own.
Yeah. Well, good luck to you.
Thank you.
Well, thanks, Norma, for sharing, and you always asking great questions as well as the others. Any other questions for Bobbi? Well, I really appreciate your presentation. I learned quite a bit. I was curious about the difference between the geriatric case manager, and now I know.
Yeah.
But more importantly, just understanding and learning all of the types of services that you can provide. And it is private pay, but an aging life care manager can really help to save money.
Yeah.
In the long run, and opens your eyes to many more options. That's what my takeaway was.
Yeah.
Any other thoughts or questions? Thank you, Bobbi, for presenting and taking the time to share your knowledge and your expertise. And thank you, everyone, for attending. And we'll see you all again soon. I'll be announcing the October, at least one of the 2 webinars on Friday in the email newsletter. So everyone, take good care, reach out if you need anything, and enjoy the beautiful day.
Thank you.
You're welcome. Bye.
Bye.